Despite the upward growth trajectory since independence, India's status of development leaves plenty of room for improvement, possibly because economic growth has not adequately translated into development, especially for the most downtrodden. While subsequent governments have tried their hands with various development models to ensure equitable growth, the current dispensation under Narendra Modi has altered the standard models of economic development with an approach that experts following Modi's style of governance call it an outcome-focused governance model. Be it India's massively successful direct benefit transfer mechanism or the forward planning for the vaccine distribution, Modi's effectiveness is due to a clinical focus on the last mile governance. One such interesting experiment of outcome-focused governance has been the Aspirational District Program. Launched in January 2018, it aims to transform districts that have shown relatively lesser progress in key social areas and ensure a fast-track development of these districts. 112 districts across 28 states have been identified where the focus is to improve India's ranking under Human Development Index. The program aims to develop these districts on 49 key human development indexes such as health, nutrition, education, basic infrastructure, agriculture, water, financial inclusion, skill development, and poverty alleviation. And by monitoring these 49 key performance indicators and 81 data points, the ADP ranks these districts on their incremental progress across multiple sectors every month. Since its launch in 2018, the program has resulted in terrific transformation and re-engineering of various systems across the many districts. Consider Bijapur in Chhattisgarh that earlier had only one specialist and about a dozen doctors and nurses. The district invested heavily in augmenting its health system. 4 primary healthcare centers were set up, the number of specialists increased 17-fold, the doctors doubled, and over 100 nurses were recruited. As a result, patients are now served 24/7. The average distance to access medical care has reduced by 30 kilometers. The aspirational districts are ripe with many such examples of improved access and enhanced quality. In Dahod district of Gujarat, Project Second Innings was launched by the district administration to increase attendance of students in schools and their learning outcomes. Retired teachers voluntarily signed up for teaching primary and upper primary classes in various subjects including languages and mathematics. In Udham Singh Nagar in Uttarakhand, Sarvajal projects involves the installation of customized and decentralized drinking water solutions, leveraging technology to bring community-level safe drinking water to the undeserved. The solar-powered cloud-connected water dispensing kiosks installed under the project have enabled citizens residing in remote areas accessibility to clean palatable water. In Ranchi, Jharkhand, women of self-help groups are being trained to lighten the lives of villagers in the district by producing portable room lights. The achievements of ADP are not only limited to social impact, but its positive externalities have extended to economic benefits as well. For instance, the significant fall in severe acute malnutrition among children recorded in a program running for a district will have a positive impact on productivity and lifetime earnings in the future. India's ADP program has also raised interest from the West. A midterm evaluation study of the ADP released by the renowned Professor Michael Porter of Harvard University and Scott Stern of MIT found that districts have made significant improvement in health, nutrition, education, and infrastructure parameters. The study documents the social development outcomes in some of the most challenging regions of India. It examines institutional best practices, coordination framework across government bodies and other partners, and governance and leadership initiatives at the district level that can be used to replicate the success of this initiative not only in the other districts of India but also in countries facing similar socio-economic challenges. In 2018, while addressing collectors and officers in charge of aspirational districts, Prime Minister Modi had said that India needs to identify existing aspirations in the districts and channelize them to create a ripple effect for transforming aspirational districts. Since then, the Aspirational District Program has been serving as a worthy example of accelerating human development in the most underdeveloped areas of the country that had so far been untouched through a meticulous and targeted approach.